Bienvenidos al Medical Spanish Podcast. Soy la doctora Molly Martin. Through this podcast, we provide interactive audio lessons for learning practical Spanish for healthcare and elsewhere. The level of this lesson is Advanced Beginner. Today we are returning to the basics again with another updated lesson from the Review of Systems module in our History and Exam course. I decided to update these super useful lessons with the help of Luis Almeida from Venezuela. Luis has recorded all the terms and phrases for this lesson in his crystal clear Spanish, ensuring we learn accurate and understandable Spanish, which our patients will appreciate. As I update these lessons, they will be available for a limited time through the podcast. If you'd like to sign up for our course covering a complete history and exam in Spanish, there's a link in your show notes. I hope you find these lessons helpful. In this lesson, we will learn symptoms that affect the skin and musculoskeletal system. Then we'll practice using these symptoms in common questions during a review of systems. ¿Listos? Empecemos. Swelling.
La hinchazón.
Redness.
El enrojecimiento.
Itch or itching.
La comezón.
O
La picazón.
hives.
Las ronchas.
Burn.
La quemadura.
Abrasion or chafe.
La rosadura.
Cut.
La cortada.
O la cortadura. Bite, as in an animal bite.
La mordedura.
O la mordida. Insect bite or sting.
La picadura.
Nodule.
El nódulo.
Although you may see nódulo linfático in medical texts and dictionaries, I've only heard people use ganglio linfático to say lymph node. Lump.
El bulto.
And as we learned in our series on the evaluation of a lung nodule, you may also hear people refer to a nodule seen on a chest x-ray or CAT scan as bulto. Bump, as in bump on the head.
El chichón.
Wart.
La verruga.
And what is a similar word meaning wrinkle? La arruga. Rash.
El sarpullido.
You can also say this with an L rather than an R.
El salpullido.
And another way to say rash is
La erupción.
burning.
El ardor.
Discharge.
La secreción.
O
El flujo.
o
La supuración.
Let's practice some more familiar terms for patients. Pus,
El pus.
fluid or liquid.
El líquido.
Stiffness,
La rigidez.
fracture,
La fractura.
wound or injury.
La herida.
Lesion or injury.
La lesión.
Sore or ulcer.
La llaga.
Ulcer,
La úlcera.
blister,
La ampolla.
changing color.
El cambio de color.
Change in size.
El cambio de tamaño.
Change in appearance.
El cambio de aspecto.
Bruise,
El moretón.
You may also hear people refer to a bruise as
El cardenal.
scar,
La cicatriz.
spot,
La mancha.
area of irritated skin.
La zona de piel irritada.
Mole,
El lunar.
unusual mole.
El lunar inusual.
Freckles,
Las pecas.
pimples. There are 3 ways to say pimples.
Los granitos. Los barritos. Las espinillas.
So people will often refer to little bumps or pimples as,
Los granitos.
and a blackhead as,
La espinilla.
and espinilla also means shin. Muscle cramps.
Los calambres.
Now, all the words we just went over can be used with the verb tener. Using the verb tener and the body part vocabulary we learned in an earlier lesson, try to form the following questions in Spanish. Utilizando la palabra sarpullido, interpreta. Do you have a rash on your back?
¿Tiene un sarpullido en la espalda?
Do you have stiffness in your joints?
¿Tiene rigidez en las articulaciones?
Do you have blisters on your feet?
¿Tiene ampollas en los pies?
Do you have a burn on your abdomen?
¿Tiene una quemadura en el abdomen?
Have you had ulcers in your mouth?
¿Ha tenido úlceras en la boca?
Utilizando herida, interpreta. Have you had an injury to your leg?
¿Ha tenido una herida en la pierna?
And if you interpreted this as ¿ha tenido alguna herida en la pierna? You would not be wrong. More on the use of algún y alguna at the end of this lesson. Have you had a fracture in your arm?
¿Ha tenido una fractura en el brazo?
Utilizando tener y comezón, interpreta. Do your feet itch?
¿Tiene comezón en los pies?
Do your hands burn?
¿Tiene ardor en las manos?
Now let's practice some adjectives used to describe the skin and joints. Swollen,
Hinchado,
inflamed,
inflamado,
irritated,
irritado,
scaly,
escamoso,
rough,
áspero,
thin,
delgado,
tan, dark-skinned, or dark-haired.
moreno,
Dry,
seco,
very dry,
reseco,
warm or hot.
caliente,
So caliente can mean both warm or hot depending on the context. For example, when offering a warm blanket to a patient in the hospital, you could say,
aquí tiene una manta caliente.
Now using the verb tener, how would you ask, is your skin really dry?
¿Tiene la piel reseca?
Are your knees swollen?
¿Tiene las rodillas hinchadas?
Are your fingers inflamed?
¿Tiene los dedos inflamados?
So here we used the construction tener más la parte del cuerpo más adjetivo to ask about states in the body.
¿Tiene la piel reseca? ¿Tiene las rodillas hinchadas? ¿Tiene los dedos inflamados?
There's a link in your lesson notes if you would like to practice this construction more. And now we're going to practice special verb phrases when talking about the skin. To ask if someone's skin has changed in a certain way, we can use the phrase
Se le ha puesto la piel.
followed by the adjective to describe the way the skin has changed. Let's practice a few questions. Has your skin become irritated?
¿Se le ha puesto la piel irritada?
Has your skin turned red?
¿Se le ha puesto la piel roja?
Has your skin turned yellow?
¿Se le ha puesto la piel amarilla?
Has your skin become tanned?
¿Se le ha puesto la piel morena?
Has your skin become scaly?
¿Se le ha puesto la piel escamosa?
Has your skin become rough?
¿Se le ha puesto la piel áspera?
Has your skin become thin?
¿Se le ha puesto la piel delgada?
Has your skin become really dry?
¿Se le ha puesto la piel reseca?
Now let's practice using the verb SALIR to ask about rashes and spots that appear on the skin. Do you break out in hives?
¿Le salen ronchas?
Do you bruise easily?
¿Le salen moretones con facilidad?
Here, Luis used the useful phrase con facilidad to say easily.
¿Le salen moretones con facilidad?
Utilizando sarpullido, interpreta. Have you broken out in a rash?
¿Le ha salido un sarpullido?
Does fluid come out of the wound?
¿Le sale líquido de la herida?
You could also use the preposition por here and say,
¿Le sale líquido por la herida?
does pus come out of the wound?
¿Le sale pus de la herida?
O,
¿Le sale pus por la herida?
now let's practice using the verb to feel.
Sentir.
Utilizando la palabra coyunturas, interpreta. Do you feel stiffness in your joints?
¿Siente rigidez en las coyunturas?
Have you felt cramps in your legs?
¿Ha sentido calambres en las piernas?
Have you felt a lump in your breast?
¿Ha sentido un bulto en su pecho?
And when it's obvious to whom you're referring, it's also common to use the definite article before the part of the body and say, ¿Ha sentido un bulto en el pecho? Have you felt a nodule in your neck?
¿Has sentido un nódulo en el cuello?
Now let's practice using the word any before a particular symptom. In Spanish, when we want to ask about any of something, we use algún before a masculine noun and alguna before a feminine noun. How would you ask, do you have any problems with your skin?
¿Tiene algún problema en la piel?
Utilizando la palabra coyunturas, interpreta. Do you have any problems with your joints?
¿Tiene algún problema en las coyunturas?
Have you noticed any nodules or bumps?
¿Ha notado algún nódulo o bulto?
Have you noticed any unusual moles?
¿Ha notado algún lunar inusual?
Have you noticed any change in size?
¿Ha notado algún cambio de tamaño?
Have you noticed any change in appearance?
¿Ha notado algún cambio de aspecto?
Have you noticed any change in the color of your skin?
¿Ha notado algún cambio de color de su piel?
Have you noticed any areas of inflamed skin?
¿Ha notado alguna zona de su piel inflamada?
Utilizando secreción, interpreta. Have you noticed any discharge in the wound?
¿Ha notado alguna secreción en la herida?
Have you noticed redness in any area of your skin?
¿Ha notado enrojecimiento en alguna zona de la piel?
Have you felt pain in any area of your skin?
¿Ha sentido dolor en alguna zona de la piel?
Have any areas of your skin felt warm?
¿Ha sentido caliente alguna zona de la piel?
Or you could change the order of the words and say,
¿Ha sentido alguna zona de la piel caliente?
Bien hecho. I hope you've enjoyed this lesson. Now there are two options to support this project and get premium benefits. You can subscribe through Apple Podcasts and get our most recent audio member lessons delivered directly through the Medical Spanish podcast feed in Apple Podcasts. Or if you sign up at docmolly.com, you'll get access to all our lessons and courses, as well as our premium podcast feed. This includes full lesson notes with downloadable PDFs and quizzes. And at the bottom of each lesson, you can ask a question and I'll respond within 24 hours. Y eso es todo por hoy. In the next lesson, Luis and I will return to practice symptoms of the eyes, ears, nose, throat, cardiovascular, and respiratory systems. Hasta la próxima! This is a production of DocMolly.com, where we learn practical Spanish for healthcare and elsewhere.